I'm Linda Jackson, and I'm the director of the Center for Arts and Health at the Metro Health System. My background is dance. I've been a dancer my whole life. I guess once a dancer, always a dancer. But I began with the dream of becoming a professional ballerina and moved to Cleveland to join Cleveland Ballet and had a long and rich career there. So I first met Bill Wade back in my Cleveland Ballet days when he joined us to be part of our annual Nutcracker production. We may have even waltzed around the stage together a time or two in the Nutcracker, but that's when we first met, and that is a special relationship and partnership that has continued now for many, many years. Having had that relationship and knowing the work, there was no question that when I began to work here at Metro Health, I knew that there would be opportunities for us to continue to work together.
Over the decades, both of our job descriptions have changed. We've changed as people, but our friendship has been maintained. And Linda's brilliant. You don't get to that level of being that good as a ballerina without having, an intellectual acumen.
Metro Health was just an incredible opportunity that came at the perfect moment in my life. I think it was something that was just meant to be. I've always been someone that is very mission driven, and the mission of Metro is something that spoke to me very much. So Metro Health's mission is leading the way to a healthier you and a healthier community through service, teaching, discovery, and teamwork. Back in 2013, there was a new president and CEO at the time, Dr. Akram Boutros, who was adamant that arts had a place in healthcare and a place at the table here in Metro Health. The Center for Arts and Health is very uniquely positioned here at Metro Health. We're under the umbrella of what's called the Institute for Hope. The Institute for Hope's mission is to address the social determinants of health among our patients and the community to equitably improve health and quality of life. Inlet was one of the first arts partners and arts organizations I reached out to. We brought the company here as our first live performing arts event in our rotunda near the emergency department. And patients and staff and community members all came to enjoy that first performance. We wanted to continue to work together, but of course our main campus, our anchor institution, is right here in the Clark Fulton neighborhood. And it is an anchor too. And certainly we began working with Inlet long before they moved into the Clark Fulton neighborhood. So the opportunity to have them as neighbors and the opportunity that would open up for us to collaborate and focus on this neighborhood and its rich community, we were very excited about.
It is amazing to me that Metro Health Systems actually genuinely cares about the people that they reach in the community. And they're putting not just the arts, but all kinds of things into place to gain access to quality care and focused on the health determinants of a community. The arts component of that is really, really kind of boots on the ground proof of that. That impact in this community it's amazing. And it's far-reaching throughout the greater Cleveland area. It's very, very unusual to have a professional dance company in the marketplace working so closely with an arts component of a hospital and together creating quality programming for these neighborhoods that definitely deserve to have them and traditionally haven't.
We have worked together on many richer, deeper programs, including the SAFE Project. It stands for Students Are Free to Express, and it is a psychologically informed, arts-based primary prevention curriculum that we bring to the students of Cleveland Metropolitan School District directly in the classroom with several arts partners to address the trauma and toxic stress that our students unfortunately face. Most recently, we've partnered with Inlet on a pilot program called ArtsRx. And ArtsRx is actually social prescribing of the arts. So basically what we are doing is prescribing the arts for our patients. The greatest risk of the community that we have found is for social isolation. And so ArtsRx has also helped us to prescribe for some of the patients that would like assistance with social isolation and stress.
I think the partnership between Inlet and Metro work really, really well because we listen to each other. And what's nice is that she has medical data backing up and driving some of the programming that we're doing. This is like co-creating programming and being really candid about like, this isn't working, or this aspect of this moment is working way more than we realized, and let's capitalize on that. And the ability to be nimble together is critical because and responsive to the feedback that we're getting from our constituents.
One of the easiest ways to describe why and how we work together is to think about what Inlet believes and that you can use dance to further people. So that's something that always struck an chord. So coming from that place and coming from our mission and the work and the impact that we know the arts can have and arts and health can have, it's not a question. The arts are essential. Through the growing field of practice and study of arts and health, we are finding even more rich evidence that the arts truly impact our health and our well-being.
You really want people who are that bright but also have that level of empathy in leadership roles in communities because they're poised to make a real difference. There's this constant level of engagement and support of Inlet. So watching how Linda is literally leveraging artists all over Northeast Ohio for the betterment of the community, it's kind of easy to want to honor her because that's rare. She's a rare gem in the city and she needs to be honored in